Hello everyone, welcome to sqadia.com. Today the topic of our lecture is organic mental disorders, which are also abbreviated as organic brain disorders or OBS. Now basically this is a group of disorders in which the underlying pathology is not of the psychiatric origin and it's of another pathology which can be rather medical or any surgical pathology which can lead to a psychiatric mental condition. This is the group of disorders which we will be discussing subsequently. First of all, in the very first section, we'll be defining the organic mental disorders. What are the different ranges that are related to it? And then, of course, the psychiatric presentation of such disorders will be discussed over here. So the clinical presentation is sometimes quite confusing, and it's very important to distinguish these organic brain disorders from pure psychiatric disturbances. And then we'll be following on with the classification of the organic mental disorders along with it. In the second section, we'll be discussing delirium. So delirium, as we can define it as an extreme confused state of mental condition, that basically the underlying pathology can be organic and it can be of the psychiatric origin as well. So we'll be discussing the epidemiology of delirium tremens over here, and then we'll be discussing the core features, which basically comprises of the symptomatology, including the clinical signs and symptoms of the patient suffering from delirium. And then we'll be focusing on the risk factors that can lead to such a confusional state, which is basically characterized by restlessness and even hallucinations of different kinds, for example, visual and even the auditory hallucinations. Then we'll be discussing the clinical presentation also in this section, which will of course comprise of the symptomatology and the clinical signs that can be demonstrated by the clinician as well. In the very third section, we'll be discussing the diagnosis of this condition, which is known as delirium. So it's again very important to differentiate between delirium and the organic mental disorders and other behavioral disturbances, which can be of an acute or of the chronic origin as well. So we'll be discussing the differential diagnosis in detail over here. If a person is acting in an anxious way and he's restless and he's having hallucinations of any type, how can you distinguish what kind of a psychosis he's suffering from? So it's again very important and very crucial over here to discuss all these things. In the very fourth section, we'll be discussing the management overall. So as the patient walks into your clinic, the management starts on. It also includes the history taking in detail. Obviously, the collateral history is also included in this. And then we'll be dealing with the treatment modalities. Obviously, it consists of the psychotherapies as well as the pharmacotherapies that can be related for the management of this delirium in a particular patient that we're talking about. Then delirium tremens, it's another terminology quite oftenly used, and we'll be defining what do you mean by these terminology and how do you differentiate delirium from dementia. So dementia is basically the loss of memory, and delirium, as we've already defined, it's basically an extreme confusional state in which the person is restless and he's having hallucinations of all kinds. So we'll be differentiating clinically how can we administer or how can we really administer these differences in a patient who's suffering from delirium and then in a patient who's suffering from dementia. So I hope you want to learn more about these organic disorders. So do watch the other sections to this lecture as well.